Good evening. My name is Cordelia Padua. I am a DMP student at Brandman University. This evening, I'm going to present a topic on obsessive compulsive disorder, and I will be presenting three different modalities on how to treat OCD. Uh, the therapy modalities are exposure therapy, cognitive therapy, habit reversal therapy. My presentation will be of two parts. The first part will be the discussion of the three modalities, and the second part of this presentation will focus on patient interview. History of present illness, chief complaint. My life is a mess. It looks like I am losing my mind. Emma is a 34-year-old African American female. She is a stay-at-home mom. She is married with three children. She lives with her husband, who is solely the breadwinner of the family. Emma worries constantly about falling ill and not being able to care for her children. Her fear drives her to take extreme precautions towards avoiding exposing herself to germs. She spends hours every day disinfecting her home while her children are at school. Anytime she comes in contact with surfaces she believes are unclean, she feels compelled to immediately shower or wash her hands. Because of her excessive hand washing, she has extremely dry hand, red, chapped, and cracked skin due to the hand washing. Aside from her obsession with hand washing, Emma experiences the obsession of rearranging objects in her kitchen to ensure a specific order or symmetry. She can spend hours arranging and rearranging dishes in the kitchen. Emma believes that if the dishes are arranged in a certain way, her husband will not die. Emma's compulsions are aimed at getting rid of her anxiety or to stop a situation that she is afraid of. Because Emma's current obsession and compulsion, her husband threatened to leave her. Emma is distraught at the thought of losing her husband and has resorted to drinking. What is obsessive compulsive disorder, OCD? Obsessive compulsive disorder, or OCD, is an anxiety disorder that is characterized by two core symptoms: obsessions and compulsions. Obsessions are thoughts or image or ideas that won't go away. They are unwanted and cause extreme distress. For example, if you might worry constantly about becoming contaminated with a deadly disease, that you will do something terrible or that something horrible will happen to your loved ones. Other obsessions include repeated doubts, such as believing you may have hit somebody with your car, or you need or an aggressive, disturbing ideas such as thoughts of murdering your partner or child, disturbing sexual and religious imagery. Compulsions are behavior that you feel and you must carry out over and over. For instance, if you're obsessed with contamination, you might wash your hands over and over again. Other common compulsions include cleaning, counting, checking, requesting or demanding reassurance, and ensuring order symmetry. The three modalities that I'm going to discuss in this presentation are: number one, exposure and response presentation, or ERP. This is a form of cognitive behavioral therapy that it is a psychotherapy of choice for treatment of OCD. It is a therapy. People who have OCD are placed in a situation where they are gradually exposed to their obsessions and asked not to perform the compulsions that usually ease their anxiety and distress. This is done at the patient's pace. The therapist will never force the patient to do anything that she does not want to do. The first step is to have the patient describe all her obsessions and compulsions. The therapist will ask patient to confront her fear. For example, patient fear of germs in public places and fear of contamination and illness from germs. The therapist will design a task for the patient that exposes her to her fear. If a patient's usual response is to wash her hands immediately after touching doorknobs in public places, the therapist will ask her to wait before she washes her hands. As the therapist repeats this exposure task, as the therapist repeat this exposure task, the therapist will ask the patient to wait longer and longer before washing her hands. Over time, this gradual exposure and delayed response would help the patient learn to control her fear of germ in public places. With repeated sessions, the severity of this anxiety and the amount of time the anxiety lasts begin to decrease. With continued practice, the need to engage in compulsion to relieve the anxiety starts to go away altogether. Number 2, second modality is called habit reversal training. This intervention includes awareness training, introduction of competing response, social support, positive reinforcement, and often relaxation techniques. Awareness training may be practicing the habit in front of a mirror, focusing on sensations of the body and specific muscles before and while engaging in such behavior, and identifying and recording them as the habit occurs. This techniques increases awareness of how and when the urges develop, making it more likely that an individual will be able to intervene and make change. This method of treatment takes time, diligent practice, and patience, as well as integrating relaxation skills prior to beginning. Also, extremely critical to success is the support and positive reinforcement of the family. The third modality is the cognitive therapy. Cognitive therapy helps to understand that the brain is sending error messages. The therapist will help the patient learn to recognize these messages and respond to them in new ways to help the patient control her obsession and compulsions. Cognitive therapy focuses on the meanings we attach to certain experiences that we misinterpret. For example, if a friend passes you without acknowledgement, you might interpret her action incorrectly and think, oh, Emma doesn't like me because she didn't say anything. And you might believe your thought is very important. Cognitive therapy helps the patient stand back from these thoughts, look at the evidence closely, and tell herself something more realistic or accurate. In this case, it might be something might be wrong with Emma, not necessarily that she doesn't like me. Cognitive therapy for OCD focuses on the experience of negative thoughts. While most people easily dismiss such thoughts, some people may have certain beliefs that thoughts are always important. Some, instead of being able to just forget about these negative thoughts, their beliefs cause them to react differently and might make them think, I am a bad person. Research shows that believing that negative thoughts are important and attempting not to have bad thoughts actually produces opposite effect. What are the expectations of these 3 modalities? The ultimate goal for these modalities is to translate to real world where patient can resist her compulsions and can embrace uncertainty rather than fear it. The expectation is that the patient or the person will no longer avoid or respond negatively to their feared situation or things, and is able to overcome their fears, phobias, situations, or things or anxieties. These three modalities have been found to be helpful in short-term and long-term for people with OCD. They have also been known to help build trust between patient and the therapist. The three modalities will benefit people from all backgrounds, religions, and different ethnic groups. They should help all people suffering from obsession compulsive disorder, regardless of their background or belief. According to a study by Mayo Clinic researchers published in Behavior Research and Therapy in 2015, they found that these modalities, exposure therapy, habit reversal therapy, and cognitive therapy, not only are safe and tolerable, but also result in greater improvement in fewer sessions. My hope is that after the treatment of Emma's OCD using these three modalities, she will be empowered and be able to make better choices and live a fulfilled life. In summary, I chose these three modalities and synthesized them because I believe that the benefit of synthesizing these modalities will engage the patient in order to ensure collaborative and thorough process for working through disruptive thoughts, emotions, and promote well-being by decreasing distorted mindset. Some may ask if cognitive behavioral therapy, CBT, works for the treatment of OCD. The answer is yes. CBT has been proven to help thousands of people learn to control their obsessive compulsive disorder. According to an article by OCDUK.org, research shows that as many as 75% of patients who seek CBT as treatment for OCD find it to be effective in treating the disorder. This ends my first phase of this presentation. Hello, this is the second part of this presentation, my patient interview. Hello, Ms. Emma. Welcome to our first session. How are you doing today?
I'm doing okay.
Do you consent to my taping this session today?
Yes, as long as nobody else will see it.
Oh, no, nobody will see this tape. This is just for the purpose of my therapy session with you. Is that okay?
Yes.
Okay. Ms. Emma, please, can you describe what brings you here today?
Okay. I have this thing with germs. I'm constantly washing my hands, and so it's made my skin really dry and chapped and cracked. And then at home, I'm constantly arranging and rearranging dishes in the kitchen. Somehow I believe that if I don't rearrange them in a certain way, that my husband will die. It has really disrupted my life. My children don't like coming to me. My family members call me crazy, and it's caused me to be anxious all the time.
Please describe how you feel when intrusive thoughts overpower you. How do you feel? Can you talk about some of those symptoms that you may experience?
I feel very anxious and overwhelmed. Like my heart starts racing. My palms get really sweaty. I feel defeated and out of control, like I can't help myself.
I am so sorry to hear that. Today we'll use a cognitive behavioral therapy known as exposure and response prevention therapy. In this therapy, you will be expected to confront your obsessive compulsive behavior. For example, you will be expected to resist your hand washing ritual after touching surfaces, especially in public places like you would normally do. We will repeat this motion without hand washing. The idea is that the severity of your anxiety and the urge to wash your hand will slowly decrease. Can you see yourself doing this?
Yes, I'm willing to try it.
Can you please touch that doorknob and try as much as you can to resist the urge of washing your hand and see how you feel?
Okay.
Okay.
Oh, wow.
How does that make you feel?
I can't stand not washing my hand. It feels like the germs are consuming me.
I'm so sorry to hear that. Miss Emma, this ends our first session. I'll see you next week.
Okay, thank you.
Hello, Miss Emma. Welcome to our second session. How are you feeling today?
Oh, I'm feeling overwhelmed. Feeling overwhelmed and anxious.
Do you consent to me taping this session today?
Yes, I consent to the taping.
Okay. Please, can you share some of your recent obsession and compulsion symptoms and how you feel that they have interfered with your daily life?
Okay. Well, my obsession and compulsion has caused me distress. My husband resents my behavior. My children hate my obsession. I feel like I'm all alone, no support, like my world is caving. And then to make it worse, I started drinking to help me cope.
Oh, I'm so sorry to hear that. Is there anything that you can do that will help decrease your symptoms?
I don't really know, but I guess I could try to control my drinking. And then maybe I can start doing Zumba again because that was something I used to enjoy doing in the past. But I stopped because I thought the sweat would give me germs. But I could start doing that again.
That sounds like a great idea. Today we are going to try another cognitive behavioral therapy. This one is called habit reversal training. This focuses on awareness training that includes involving social support and positive reinforcement. We will also use relaxation exercise, breathing exercise, and the awareness training is to practice your habit in front of a mirror, focusing on your sensation of your body and the specific muscles used that are involved. Can you do you think you can do something like this?
Yes, yes.
Okay, can you let's try the breathing exercise.
Okay.
Take a deep breath, breathe through your nose and let your shoulders down and relax and breathe out. Okay, and then practice. I want you to practice. You look in the mirror and then practice doing the rituals and tell me how you feel.
Okay.
How does that make you feel after washing your hands while you're looking at yourself and performing that ritual? How did that make you feel?
It made me feel foolish. It didn't look normal, obsessing over and washing hands like that. But the breathing made me feel calmer. The breathing exercise would help me to feel more in control.
Oh, thank you. Thank you for sharing that. This will conclude our second session. I will see you next week.
Okay, thank you.
Hello, Emma. Welcome to our third session. Do you consent to taping this session today?
Yes, I consent.
Okay. Can you share some of your recent symptoms and symptoms that have persisted?
Well, I still have the urge to wash my hands after touching any surface, but at home it's not as bad. But it's actually in public places where it's still kind of bad, but it's not as bad as it used to be.
What is your motivation to change on a scale of 1 to 10, 1 being the least motivation and then 10 being the highest? Can you tell me where you rank?
I think a 9, because at this point I'll do anything to save my marriage and keep my family together.
Well, we're going to try the last therapy modality. This is called the cognitive therapy. This modality will help you understand that understand you when you engage in obsessive behavior. You will you should understand that your brain is sending wrong messages. My role as your therapist is to teach you how to recognize and respond to appropriate way of controlling your compulsion and obsession. This therapy will help you to reason appropriately and it will prevent negative thoughts. Let's focus on positive thinking, on positive thoughts. When negative thoughts come to your mind, replace them with positive. Can you see yourself doing this?
Yeah, yes, it
Can
sounds like.
you share a situation where you will replace a negative or a thought with positive? Can you share with me?
I guess after our last session, when I remember there was a time I touched the knob. I went somewhere and I opened the door. I thought I was gonna die, but then I quickly replaced that thought with going to the beach with my family, and that helped me through that time.
Oh, I'm very happy to hear that, Mr. M. I hope these therapy sessions have been helpful to you. This will conclude our third session. Thank you for coming.
Thank you.